Hi viewers and my dear students, hope all are healthy and fine and you are ready for our online class. Good morning to everyone and welcome you all in our channel rgcsk.edu. Today in our live section, we will see one of the subject that is the medical surgical nursing and the pediatric nursing. The topic is rheumatic heart diseases. This will be benefited for all the nursing students and it is one of the important cardiac condition that all the health workers we need to understand, and if we are knowing the knowledge regarding rheumatic heart disease, we can give an education for the common people how to recognize this rheumatic heart disease and how to manage, because this condition will leads to lifelong threatening situation for the patients. So when the patients can be recognized they are having rheumatic heart disease, that can be easily diagnosed and the worsening symptoms can be manageable by our prophylactic antibiotic therapy. So as a nurse we should understand about this condition. So in our class we will today see about what is meant by rheumatic heart disease. First we will see about the introduction, then we will discuss about meaning and definition of rheumatic heart disease and what are the incidents and causes and risk factors. Next we will detailedly explain about what is the pathophysiology of rheumatic heart disease. Next we will see about the clinical manifestation, that is signs and symptoms, and next we will see the diagnostic evaluation and management and what is the prevention aspects in rheumatic heart disease and what is our nurse's role in rheumatic heart disease. So let us start our section. First we'll see about introduction of rheumatic heart disease. Rheumatic heart disease, it is one of the life-threatening cardiac condition that affects the population that will leads to multi-system disorder. Mostly different system will be affected. Here mainly the central nervous system, cardiac system, then next skin and cutaneous, and mainly our synovial joints are affected. So as a result, the person will have multi-system problem. If the person is having cardiac lesions, there is more risk for getting heart attack and death of the person. And this disease condition mainly happen in the younger age. If the child is of 5, 6, 7 years, if the child is getting this infection, repeated attack of rheumatic fever will be there and the child will get long-term complication. Sometimes in the acute phase, the child can cause death due to infective endocarditis or congestive cardiac failure. And if we are managing the child during this phase, again if the child is getting repeated episodes of rheumatic fever, there is a chance for getting scarring and stenosis of the mitral valve, and aortic valve leads to mitral regurgitation and aortic regurgitation and stenosis, and even long-term complications can be affected. So this is the major severity of this rheumatic heart disease. So when a child is getting the rheumatic fever, throughout the life the child has to be taken the prophylactic antibodies in order to prevent the long-term complications. So there will have so much of emotional, physical and social disturbances for the child for the day-to-day activities. So as a nurse, we have to recognize the problem and we have to bring out a good prophylaxis modification or therapy for the child and withhold the child throughout the course to minimize the complications. And in worldwide, globally, more than 39 millions of populations are affected with rheumatic heart disease. Among them, more than 3 lakhs of people is getting death, one of the leading cause of cardiac death due to rheumatic heart disease. Most of the cases, the parents are unaware about the diseases and unaware about the immediate complication or acute phase complication of the diseases. And there have a lack of awareness about the healthcare workers to give a prompt therapies and prevention modalities in rheumatic heart diseases. So as a need, as a nurses, we should be more aware about the rheumatic heart disease, and we should recognize the symptoms of rheumatic heart diseases. We have to give a hand with our physician to give a supportive therapy for all the cases, those who are coming in our hospital with the vulnerability of getting rheumatic heart diseases. Let us see what is the meaning or definition of rheumatic heart disease. Rheumatic heart diseases, it is a chronic heart disease caused by one or more episode of rheumatic fever due to the causative organism group A beta hemolytic streptococcal organism. This will leads to multi-system disorder such as cardiac lesions, central nervous systems, and skin, subcutaneous tissues, and synovial joints is affected. Or we can otherwise tell rheumatic heart disease, it is a chronic type of cardiac disease caused by rheumatic fever leading to permanent scarring or stenosis or torsion of the mitral valve, leads to cardiac problem. So what is the main reason behind getting rheumatic fever? So rheumatic heart diseases which leads to acute phase or chronic phase. When they are getting with the rheumatic fever, the patients will have a autoimmune responses. So we can tell or we can define the definition as rheumatic fever. It is a multi-system disorder caused by autoimmune disease or infection and inflammation of the human body as a response to group A beta hemolytic streptococcal infections. That is known as the strep throat. After a period of consecutive phase, that is 2 to 3 weeks after this fever, they will have the symptoms such as joint pain will be there, chest pain can be happen, the patients can express the features of sore throat and the features of skin lesions and nodules that is formed in the subcutaneous tissues, and they have a ataxia, features of involuntary movement of the extremities and the facial muscles. So this is the main characteristics of rheumatic heart disease. So from the definition you can understand the rheumatic heart disease is as a result of rheumatic fever. So what is the cause of rheumatic fever? Or we can tell it as a scarlet fever. This is due to the organism known as group A beta hemolytic streptococcal infections. So when this infection is affecting with the child will get the strep throat or throat pharyngitis or tonsillitis can be happen. As a result, in our body, the autoimmune response will be there. Against this antigen, antibodies will be produced by the macrophages, and this will have a production of more antibodies in our human body in response to this antigen, and they cannot recognize the streptococcal infection. This streptococcal self membrane consists of proteinium that is similar to the human connective tissues cell membranes. So same repetitions of antibodies will be formed, and this will be fight against our own cell membrane. As a result, it is known as autoimmune infection or inflammatory conditions that happen in our body. So the definition says rheumatic heart disease, it is a chronic multi-system disorder caused by autoimmune infection or inflammatory of the human body as a result of one or more episode of rheumatic fever leading to chronic stenosis or distortion or damage of the mitral valve and causing multi-system problem such as central nervous system, skin, cutaneous, joints, and the cardiac lesions. So I hope you have understood about the definition. Next we will discuss about what are the causes and risk factors of rheumatic heart disease. From the definition, you can recollect what is the organism. That is the main causative organism. So once again I repeat, that is group A beta hemolytic streptococcal infection. That is a bacterial infections. Hemolytic means destruction of the RBC. So you can remember as group A beta hemolytic streptococcal infection. That is the major cause for getting rheumatic fever or scarlet fever. Later, if the child is getting more episodes of rheumatic fever, then they can get the rheumatic heart disease. And during this acute phase also, they can get infective endocarditis, myocarditis, and pericarditis also. Next, what are the risk factors? Main risk factors such as children's. So this disease mainly happens within 5 to 15 years of age group. Under 25 years, we can commonly see this rheumatic heart disease due to this causative organism. And mainly this disease affecting the low socioeconomic group. Low socioeconomic group, they are living in an overcrowded region. So the infections can be spread from one person to another person. Let us see, and in the developing countries also, this disease is severity is more, that is rheumatic heart disease. And most of the population, the people will get rheumatic heart disease, or the rheumatic fever. Rheumatic fever may be of streptococcal infection. Sore throat will be happening. 98% of the population, they will have own antibodies against the antigens, and that bacteria will be vanishing from our body. But 2% of cases, they will develop autoimmune, inflammatory, infectious responses in our body, and this will leads to the child will have the multi-system problems. So next one is the pregnant women. Pregnant women also more vulnerable group for getting streptococcal, this rheumatic heart disease. So these are the major or repeated attack of streptococcal. If any family members is having rheumatic heart diseases, that also can leads to rheumatic heart diseases, as it can be spread from one person to another person. So these are the causes and risk factors of rheumatic heart disease. Then we will discuss about what is the pathophysiology. So pathophysiology of this rheumatic heart disease, mainly of causative organism. So due to the risk factors, maybe the child in the school environment, or in the overcrowding region, or in the overcrowding housing area, low environmental sanitation, or in any family person having this rheumatic fever, this can be spread to one person to another person. So everybody will get rheumatic fever, but only 2% of cases will leads to complications of rheumatic fever. So here you can see this group A beta hemolytic streptococcal infection that will enter into the human body, mainly in the pharynx and the tonsils. Mainly the pharynx will be affected. So we can tell it as a strep throat. Or two problems the human body can be get. One is tonsillitis and another one is pharyngitis. So this pharyngitis will come, and 98% of population, this will resolve itself. Then we are taking antibodies or like that. Or self anti-immune will be produced in our body, and the condition will be resolved in our body. But 2% of cases, if they are having any genetic features or their immune is very weak, they can able to get this rheumatic fever into rheumatic heart diseases and get a complication of multi-system disorder. Actually, during this pharyngitis phase, what happened? Our body will be producing immune response against this foreign body. That is the group A beta hemolytic streptococcus. So this bacteria have the antigens. So our body will produces the neutrophils and macrophages. So this will produces the antibodies against this antigen. Somewhat they will fight against this antibody to control the symptoms, or to eliminate this bacteria from our body. In some sort, what is the main features of this streptococcal bacteria means, here the cell membrane contains protein M. This protein M is similar to the protein M that is present in our human body. That is, wherever we have the connective tissues, in that cell membrane also similar to that of the bacteria. So our body will produce the antibodies against this group A beta hemolytic streptococcus. They will feel like the same structure is present in our human body also. So autoimmune antibodies will be produced against our body. So our body will produce autoimmune response against this infectious agent, and this will form self infections and inflammatory responses to our body, such as it can attack the central nervous system, it can attack the cardiac muscle or the layers and the valve, it can affect the skin, it can affect the subcutaneous tissues, and it can affect the joints. So this happened. So you understood, no? First what happened? The group A beta hemolytic streptococcal infection, due to the spread from one person to another person, it will enter in the child pharynx. That through the mouth or nose, it can enter into the child pharynx. The child can get pharyngitis or tonsillitis. So this infection in our body, they will produce antibodies against these antigens to fight and control the infection. So the similar structure cell membrane is present in our body and in the bacteria. So what happened? We will get the body, our human body will get confusion, and this will produce antibodies against the same cell in the human body. As a result, the human body will produce so much of immune responses that will lead to autoimmune infection and inflammatory responses. So this infection can be spread to the bloodstream. So first we will discuss what happens in central nervous system. So when it is go to the bloodstream, it will reach to the central nervous system. Central nervous system, what the cells is mainly affected means basal nuclei of the central nervous system. In this basal nuclei, when it is affecting the cells, there also infections and inflammatory responses will be produced. The neutrophils, macrophages, like that immune responses will be there, and antibodies will be produced against our own cells in the central nervous system. So here what happened? The motor responses will be affected. So this is needed for central nervous system. In the basal ganglia, we are needed for the balance. So automatically the balance of the child will be affected. So here the symptoms, they will get chorea. So here they will have purposeless involuntary movement of the hands and the face. Purposeless involuntary movement of the hands and the face. We can tell it as an ataxia also. So involuntary movement of the hands and the face will occur as soon as the fever, or this can happen 2 or 3 months after the rheumatic fever attack also. So this is the happens in central nervous system. Central nervous system, the basal ganglia will be affected and will leads to disturbance in the motor responses. As a result, the patient will have the features of chorea. That is involuntary purposeless movements that happens in the extremities, mainly in the hands, and the facial part also will be affected. And next one is what happened? This infections from the throat that can be traveled from one place to another, that is in the joints. What happened? All the larger type of synovial joints can be affected. Joints mainly in the knee joints, ankle joints, elbow joint, wrist joints will be affected. So when this joint is affected, inside the joint they will have production of immune response, neutrophils, macrophages, basophils, lymphocytes, everything will be formed, and the joints will be getting inflamed and infection. As a result, joints will have some clinical manifestation like arthralgia. So pain in the joint is known as arthralgia. So they will have pain in joints, that is known as arthralgia. And another symptoms the child can get, that is arthritis. Infection and inflammation of the joint is known as arthritis. So here common features such as swelling in the joints will be there, and tenderness will be there, and pain will be there. Pain, tenderness. Tenderness means touch, while touching the joints or the knee, the child will have the pain and swelling. These are the three characteristics comes under the arthritis. And another one is polyarthritis. More than one synovial joints can be affected. In the knee, in the elbow, in the wrist. So like that, the joints can be affected. That is polyarthritis. And another features is that migrating arthritis. So the pain can be felt in one joint, one particular episode, then next another joint, then another joint. So migrating pain arthritis can be happen. So these are the problems that will happen when the synovial joint is infected and inflamed due to this causative organism. So you understood about first what happened in CNS, next what happened in the joints. Next we will see in the skin. So this infected antibodies can travel and reach into the skin. In the skin, here also the infection and inflammatory autoimmune process can be happen, and here skin lesions or scar can be formed. The sore skin or skin lesions. How the skin lesions can be differentiated in rheumatic heart diseases. In the skin lesions, they have a macule type of skin lesion. In the macule type of skin lesion, the central area will be healed very fast, and outer edges or the outer margin, they will have reddish in nature because non-healed area. So as a result, this macule type of skin lesion is known as erythema marginatum. Erythema marginatum. So the erythema means reddish color. Marginatum means in the margin. So the reddish color is present in the margin of the skin lesions, not in the center part, because the center part is healing. This is one of the features of skin lesions that present in the rheumatic heart disease. So you can understood, no? So here in the rheumatic fever, what happened? This infections can enter into the skin, and skin can produce infection and inflammation. Due to that, they will have a specialized type of skin lesion that is known as erythema marginatum. Here in the middle portion of this macule, healing process will be there. At the edges, non-healing portions will be there. As a result, the edges will look more reddish than the center part. So as a result, it is known as the erythema marginatum. So you can remember erythema marginatum is the skin lesion that is present in the rheumatic heart fever. Then these three concepts we have seen in the pathology. One is central nervous system, another one is joint, and third one is skin. Then next one is subcutaneous tissues. In the subcutaneous tissues, what happens? This infected organism can enter into the subcutaneous tissues. In the subcutaneous tissues, this can develop so much of inflammatory process. As a result, the subcutaneous tissues that is mainly present in the joints and in the bony part, they can form like a nodule. They can form like a nodule of less than 2 centimeter or minimum of less than 0.5 centimeter. This nodule will the characteristics, painless nodule will be there. Painless nodule will be there, and the nodule will be well circumscribed, and well marginate nodule will be there. So this subcutaneous nodule is one of the characteristics of this rheumatic fever. So because of the collagen deposition, this nodule is formed in the subcutaneous tissues. So next we will go with the cardiac lesions. What happened in cardiac heart due to this rheumatic fever? When the babies or children is having rheumatic fever attack, this infection can spread to the heart layers. Mainly the heart layers, you remember 3 layers are there. Pericardium, outer layer, middle layer is known as the myocardium, inner layer is known as the endocardium. So the 3 layers will be affected. So this layers also, the infected organisms cell membrane contains the protein and same features will be there. As a result, our body will produce the antibodies against our own cardiac cells. As a result, infection and inflammatory mediators will be produced. Here, in this pericardium, if infection and inflammation is happening in the pericardium, then we can tell as pericarditis will be happen. In the pericarditis, what happened? Where the infection is there, that particular area will form so much of fibrin deposition. So this pericardium is arranged with the fibrin deposition. The clinical features they can see when they are in the naked eye, bread and jam-like appearances will be there. Layers between so much of fibrin tissues will be there. So this is one of the features. So this pericarditis will leads to cardiac problem for the child. Then next one is you can remember myometrium. So when the myometrium is affected, myocarditis will be there. Here there will be changes of so much of process, infiltration of the cells will be there. So when the infection is there, inflammatory mediators will be produced, neutrophils, lymphocytes, collagen, plasma cells, and you can see the macrophages. The macrophages will be bigger in size and big nucleus will be there. So this macrophages all together, all these cells, we can tell as cellular infiltration. So this will known as the Ascough bodies. The cellular infiltration that is present in the myocardium is known as Ascough bodies. This will leads the myocardium to relax or weaken, and the myocardium cannot be function. It cannot be contracted. As a result, mostly the left-sided heart failures can be happen. So severely heart failure, it is the end of myocardial infections. Acute phases, sudden death will be there as a result of congestive cardiac failure. Next one is endocardium. So endocardium, it is a dangerous part in this rheumatic heart diseases. Chronic, so many episodes is there. Chronic attack will leads to stenosis and distortions of the mitral valve. So here infective endocarditis will be there. So this infective endocarditis will leads to some changes in each episodes of rheumatic fever. What happened? In the heart, we have valves are there. Mitral valve is there, aortic valve is there, pulmonary valves are there. Here, mostly the myotic valve and aortic valve is affected. In this valve, the leaflet structures are there, and this will be connected by the papillaries and chorda tendineae. So here, what happened? This valve leaf becomes so much of edematous and swollen whenever they are getting this rheumatic fever, and their functions will be diminished. And in this leaflet, small fibrin deposition will be there, scarring will be there, and small pin-size beaded structures in the same row, lining like that, in a row type of lining, small pin-side beaded structures will be formed in the leaflet of the valve. So this is known as vegetation. So you can remember in rheumatic heart disease, one of the feature is vegetation, that is changes due to the infection and inflammation of the valve caused by group A beta hemolytic streptococcal infection. This vegetation is a characteristic feature of rheumatic heart diseases. So this vegetation on a sudden it will not happen whenever the child is getting repeated attack of rheumatic heart diseases. This vegetation can be happen. Maybe it is a long-term complications for the human. And when the vegetation happen, this will leads to scarring, collagen deposition, scarring, and stenosis formation. When the valve gets stenosis, it cannot do their proper functions. The leaf cannot do their proper function. So as a result, regurgitation will be there, leads to mitral regurgitation. The direction of blood flow will be affected. So mitral valve stenosis and mitral regurgitation, aortic valve stenosis, aortic regurgitation are the common complications, long-term complications, very difficult to regain into the normal life for the child. So these are the major systems is affected in the rheumatic fever. So I hope you understood the pathophysiology. First, group A beta hemolytic streptococcal. In any infectious it can enter into the human body through the mouth or the nose into the pharynx. So pharyngitis or tonsillitis can be happen. 98% of the population, it will be resolved it won't. 2% of the population due to the uh, hereditary features, and with the infection of this group A beta hemolytic streptococci, autoimmune response and inflammatory mediators will be produced, and this will leads into the blood stream and enter into different areas such as central nervous system. Central nervous system, the basal ganglia will be affected and motor responses will be affected, and the patient will have the symptoms of chorea. Then second one is joints. Joints, synovial joints will be affected and they will have the symptom of arthritis, polyarthritis, migrating arthritis will be there. And when it is reaching the skin, they will have the features of erythema marginata. Then in the subcutaneous tissues, they will form like a nodules. In the heart, the layers of the heart will be affected: pericarditis, myocarditis, endocarditis. If 3 layers are affected, then we can tell it as a pancarditis. Pancarditis. And in the valve, they will form like a vegetation features, and in the myocardium layer, it will form like a Ascough bodies due to the cellular infiltrations. So these are the major multi-system changes. Even end result can lead to death or congestive cardiac failure. Next, we will see what is the clinical manifestation. So in the pathophysiology, we have discussed about some of the features that happen for the human body. So what are the clinical features, symptoms? So when we see the symptoms, rheumatic fever, it is otherwise known as the scarlet fever. This will get the pharyngitis. So if any infection is there, our body will produces the cytokines and leads to metabolism. We can have the symptom of fever. High grade fever will be there, above 38 degree to 40 degree Celsius. And strep throat, pharyngitis will be there for the patient. And the patient will have the symptoms of malaise. If this joint pain can be there, tenderness in the joint can be identified, and the patient can be complaint of migrating pain in the joints. And if the symptom is severe symptom is there in the skin, the patients will tell they have like skin rashes, mainly in the upper part of the body, central region, the chest region, like reddish color lesions is there, or they can tell some nodules are present in the body. If the heart is affected, the child will have the symptom of chest pain will be there, dyspnea will be there, palpitations. These are the common symptoms the patients will complain. Next, what are the signs we can elicit it? Signs, when we check, high temperature will be there, increased palpitations, tachycardia can be assessed, and polyarthritis, arthritis features I told, pain, swelling and tenderness, and migrating arthritis, and pharyngitis, infections, no, sore throat can be assessed. We can see the swelling in the pharynx when we are opening the mouth for the patient, and we can see if the patient is having cardiac problem, severe chest pain will be there. But when the child is leaning out, they can reduces the chest pain. That is one of the features of rheumatic heart diseases. When they are leaning forward, the chest pain will be reduced. So like that symptoms we can elicit it, and we can find out the shortness of breath or dyspnea if any chest problem, cardiac lesions is present. And the skin, we can notice the erythema toxicum, nodules can be assessed in the joints or on the bones. So these are the main clinical features. Then next we will move on the investigation. Investigation mainly based on the clinical features. So the doctor will be diagnosed what type of clinical features is there, whether rheumatic fever is there, whether the child is getting rheumatic heart diseases. Because once the diagnosis is done by the physician, it is a long-term medication we are giving for the children. If the child is diagnosed in the 6 years, she or he has to take the medication or antibiotic prophylaxis till 15 years, or if they are having again attack daily, they have to take oral medication, or monthly they have to take IM injection of antibiotics. So it is not a easy task for the physician to diagnose it. Once they are diagnosed, they have to clearly diagnose it. So this based on the clinical manifestation, John criteria is there, and nowadays modified WHO criteria also is there. They have divided the symptoms into diagnostic criteria into two, major and minor. Major criteria here, cardiac lesions, chorea. Chorea, you know what is chorea? Chorea, it is the ataxia type, involuntary purposeless movements that happens in the hand and the face. Chorea is involuntary purposeless movements that happens on the face and the hands, like ataxia. So that is known as chorea. In major, chorea is there. The next one is erythema toxicum is there. Nodules are present, and arthritis and polyarthritis, and joint pain. So these are the major criteria. Chest pain also. The next one is minor criteria. Minor criteria, here fever is there, polyarthritis. The next one is ESR. When the ESR rate is increased, C reactive protein level is increased, then we can tell it as a minor criteria. So this major and minor criteria can be known by the physicians, and they can judge whether two symptoms is there from the major criteria, or one symptom from major, or two symptoms from the minor criteria. Then they can diagnose it is the rheumatic heart disease. So you can remember John's clinical manifestation criteria for rheumatic heart diseases. Same like WHO also is there. Next one is investigation. Investigation, mainly throat swab can be taken. So pharyngitis is there, throat swab can be taken and identify what organism is present. Mainly you can remember group A beta hemolytic streptococcal infection. That organism has to be present. Then rapid antigen, that is antibody test can be done. So rapid test can be done to find out what type of antigen is present. The next one is anti-streptin O titer can be assessed. If streptococcal infection is there, anti-streptin streptolysin titer will be increased. So that can be assessed. And these are the major blood and other things, complete blood count, platelet level, and ESR has to be monitored. ESR level will be increased. C reactive protein, that level also will be increased. Okay, so this basophil, neutrophil, that all can be assessed in the blood investigation. Next one is chest examination can be done. Chest examination, mainly the doctor will be doing pleural drop, murmur. So like that, features can be assessed in auscultation. The next one is ECG. ECG, prolonged PR interval can be assessed, and echo, cardiomegaly will be there, and infective carditis can be assessed. Myocarditis, pericarditis, epicarditis, endocarditis can be assessed, and valvular stenosis and valvular distractions can be assessed in the cardiac images. So these are the major investigation. So with the investigation along with the clinical symptoms, the rheumatic heart disease can be assessed. If the person is getting rheumatic fever, within 2 or 3 weeks, the multi-system features can be seen for the patient. So they will get arthritis, they will get chorea, they can get skin lesions like erythema marginatum, nodules formation, and they can have features of cardiac lesions. Cardiac lesions will lead to permanent long-term consequence for the patients. What permanent long-term consequence means? They will get valvular damage and stenosis, dysfunctions of the valve. Other symptoms, when they have the episode of rheumatic fever, the symptoms will be there. When the episode is controlled, the symptoms also will be controlled. What complication on the acute phase, that complications will be happening. The cardiac lesions such as infective endocarditis and the lesion mainly present in the valve. This will leads to valvular stenosis and dysfunction of the valve. That will leads to the long-term complications. Are you understanding? So here, this is not one time. Once the child is getting infection, again recurrent infections can be happen. Each time when the person is getting rheumatic fever, their symptoms also will be coming within 2 or 3 weeks. After the resolving the infection, the symptoms will be controlled. And what happened? This valvular damage will takes place in a long-term effort. How many times they are getting the episodes of fever, their valves will be damaged, stenosed, and they will have the features of vegetations in the valve. Later, the valve will be getting stenosis, calcified stenosis, and later distortion and dysfunction and regurgitation of the valve will happen. This will lead to congestive cardiac failure and death of the patients. Are you clear? So these are the major diagnostic evaluation. Next, we will see what is the management of rheumatic heart disease. Management, main management is prophylactic antibiotic therapy. Antibiotic therapy, benzathine, penicillin therapy. That can be given IM injection. 28 days cycle. Each month they can give the IM injection for long term, like 10 to 15 years for the child. And another one is this injection medication, oral medication can be given, penicillin B potassium, that can be given orally twice, orally for the child. Daily they have to be taken. If they are sensitive or allergic to the penicillin, another type of drug is azithromycin or erythromycin. Twice a day they can be taken for these many years. During this phase, if they have any features of fatigueness, palpitation, dyspnea, they have to come and they have to do the follow-up. Then next, pain management. If they have arthritis, polyarthritis, non-steroidal anti-inflammatory drugs can be given. Salicylates can be given. Some natural remedies, hot applications, so like that can be managed. So this is the main management is that is antibiotic, prophylactic antibiotic therapy. And for the cardiac, if they're having severe cardiac diseases, according to the physician order, cardiac drugs, diuretics, that can be given for the patients. And even in the worsened condition, surgeries can be done. So this is the major management comes under rheumatic heart diseases. Let us see that is a long-term administration of prophylactic antibiotic therapy, mainly the penicillin. Penicillin is allergic, then they can give the option of erythromycin or azithromycin. Next step is, next our topic is prevention. We will tell prevention is better than cure in all the concept.